Welcome to today's video, where we'll be diving into medullary cystic kidney disease, often referred to as MCKD. This rare, genetic disorder progressively damages the kidneys, eventually leading to kidney failure. We'll explore what causes it, how it affects the body, and what options are available for managing this challenging condition. MCKD is primarily caused by genetic mutations. The most common genes implicated are MUC1, which causes MCD type 1, and UMEN, which causes MCK type 2, formerly known as familial juvenile hyperuricemic nephropathy. These mutations disrupt the normal structure and function of the kidney tubules, the tiny filters within the kidneys responsible for reabsorbing essential substances and excreting waste. The pathophysiology of MCKD involves the formation of cysts primarily in the medulla, the inner part of the kidney. These cysts are typically small and often difficult to detect early on. The mutations lead to tubulointerstitial fibrosis, meaning scarring and inflammation within the kidney tissue surrounding the tubules. This fibrosis disrupts the kidney's ability to concentrate urine, leading to excessive water loss, and impairs the filtering process overall, gradually damaging the kidney's function and causing progressive kidney disease. Medullary cystic kidney disease is a rare disorder. Precise epidemiological data is limited, but it is estimated to affect a small percentage of individuals with chronic kidney disease. Because it's genetically determined, MCKD can affect multiple family members. It often presents in adolescence or early adulthood, but the age of onset can vary. The signs and symptoms of MCKD can be subtle initially. Common early symptoms include excessive thirst, polydipsia, and frequent urination, especially at night nocturia. As the disease progresses, individuals may experience fatigue, weakness, loss of appetite, nausea, and bone pain due to the kidney's impaired ability to regulate electrolytes and vitamin D. High blood pressure is also a common finding. In later stages, symptoms of kidney failure such as swelling, shortness of breath, and confusion may develop. Diagnosis of MCKD involves a combination of clinical evaluation, family history, and diagnostic tests. Blood tests can reveal impaired kidney function, such as elevated creatinine and blood urea nitrogen (SBN) levels. Urine tests may show an inability to concentrate urine and electrolyte abnormalities. Genetic testing can confirm the presence of mutations in the MUC1 or UO genes. Kidney imaging, such as ultrasound or MRI, may reveal cysts in the medulla, though these can be difficult to visualize in the early stages. A kidney biopsy can provide a definitive diagnosis by showing characteristic tubular damage and fibrosis. While there are two main types, MCKD type 1 and MCKD type 2, based on the gene involved, MUC1 and UMOD respectively, the clinical manifestations are often overlapping. There are other less common genetic causes of MCKD-like conditions, sometimes referred to as autosomal dominant tubulointerstitial kidney disease or ADKD, linked to mutations in genes like REN, C61A1, and HNFB among others. The specific genetic mutation can influence the rate of disease progression and associated symptoms. There is no cure for MCKD, so treatment focuses on managing symptoms and slowing the progression of kidney disease. This includes maintaining adequate hydration to compensate for the kidney's inability to concentrate urine. Medications may be prescribed to control blood pressure, manage electrolyte imbalances, and treat bone disease. A low-protein diet may help reduce the workload on the kidneys. Eventually, most individuals with MCKD will require dialysis or kidney transplantation to survive. Since MCKD is a genetic disorder, there's no way to prevent it directly. Genetic counseling is recommended for individuals with a family history of MCKD who are considering having children. Genetic testing can help determine if they carry the mutated gene. The prognosis for individuals with MCKD varies depending on the specific genetic mutation and the rate of disease progression. Eventually, all individuals with MCKD will develop end-stage renal disease, requiring dialysis or kidney transplantation. Research is ongoing to better understand the underlying mechanisms of MCKD and to develop targeted therapies. This includes exploring potential gene therapies and treatments that can slow or even reverse the fibrotic process in the kidneys. Early diagnosis and management can help improve the quality of life and prolong kidney function. Thank you for watching.